Unit 25, Mental Illness. Exercise. 25.1. Complete the table with words from A, C, D, and E opposite. Noun, affection, adjective, affected. Noun, anxiety, adjective, anxious. Noun, behavior, adjective, behavioral. Noun, dementia, adjective, demented. Noun, disturbance, adjective, disturbance. Noun, suicide, adjective, suicidal. 25.2. Make word combinations using a word from each box. Two words can be used twice. Look at B, C, and E opposite to help you. Behavioral syndrome, mental retardation, minor depression, substance abuse, sleep disturbance, personality disorder, psychomotor retardation, eating disorder. 25.3. Complete the sentences. Look at A, C, D, and E opposite to help you. 1. The way a person behaves is his or her behavior. 2. A persistent emotional state is a mood. 3. A sudden attack of anxiety is a panic attack. 4. The form of dementia associated with aging is called senile dementia. 5. A disorder which is not associated with pathological change is functional. 6. An idea which forces a patient to repeat unnecessary actions is a compulsion. 25.4. Which symptoms of depression was this patient suffering from? Look at C opposite to help you. Case 41. A 56-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She has lost interest in most things. She was sleeping poorly and tended to wake up early, but denying any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. The symptoms of depression that she was suffering were loss of interest, sleep disturbance, and fatigue. Unit 26. The nervous system 1. Exercise. 26.1. Complete the table with words from A, B, and C opposite. Adjective, blind, noun, blindness. Adjective, conscious, noun, consciousness. Adjective, deaf, noun, deafness. Adjective, busy, noun, dizziness. Adjective, lightheaded, noun, lightheadedness. Adjective, unsteady, noun, unsteadiness. 26.2. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Double vision, urinary incontinence, visual acuity, syncopal attack, epileptic fit, prodromal symptoms. 26.3. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's questions. Look at C opposite and at the table in 26.1 above to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you blacked out? Were you worried or under any stress at the time? Did you feel dizzy or numb, unsteady before the attack? Did you lose control of your bladder? Did your wife notice any rhythmic movements while you were unconscious? Unit 27. The nervous system. 2. 27.1. Complete the table with words from E and B opposite. Noun, absence, adjective, absent. Noun, diminution, adjective, diminished. Noun, flaccidity, adjective, flaccid. Noun, spasticity, adjective, spastic. Noun, waste, Adjective, wasted. 27.2. A doctor is giving instruction to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. 1. I'd like you to relax. I'm just going to move your arm up and down. Muscle bulk. 2. Can I see your hands? Muscle tone. 3. Now I'm going to straighten your arm out. Try to spot me. Muscle power. 4. Can you touch my fingers with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. 27.3. Complete the sentences. Look at A, B, and C opposite and at the table in 27.1 above to help you. Is this one? 1. A reflex hand drops limply to form a right angle with the wrist. 2. Wrist reflexes are reflexes that are stronger than normal. 4. Muscle atrophy means the muscle is reduced in bulk. 4. A tic is a form of involuntary movement. 5. A key is often needed to test the spastic response. 6. His coordination was poor. He could not perform rapid alternating movements. 7. A tendon hammer is used to test reflexes. 8. When something is diminished, it is less than normal. 7.4. A patient is brought to E&E in coma. When her name is spoken, she opens her eyes, but she does not answer questions or obey instructions. What is her GCE's score? Eye opening. 2. Speech. 3. Verbal response. None. 1. Motor response. None. 1. GCE's score 5. Unit 28. Oncology. 28.1. Exercise 28.1. Complete the table with words from E, B, and C opposite and related forms. Verb, cure. Noun, curation. Adjective, curative. Verb, excise. Noun, excision. Adjective, excised. Verb, grow. Noun, growth. Adjective, growing. Verb, invade. Noun, invasion. Adjective, invasive. Verb, obstruct. Noun, obstruction. Adjective, obstructive. Verb, palliate. Noun, palliation. Adjective, palliative. Verb, palpate. Noun, palpation. Adjective, palpable. Verb, spread. Noun, spread. Adjective, spreading. Verb, swell. Noun, swelling. Adjective, swelling, swollen. 28.2. The notes below are about the patient described in the opposite. Use them to put these sentences 1 to 9 in the correct order to make the next paragraph of the case report. Use Appendix 2 on page 20 if you need help with your abbreviation. On examination, his temperature was 37.8 degrees Celsius. There was a smooth, firm 3 by 4 centimeters mass in the right supraclavian fossa. There were enlarged lymph nodes in both axillae and in inguinal areas. His mouth controls were normal. His pulse rate was 100 mean regular and blood pressure 112 over 66. His cardiovascular and respiratory systems were normal. On abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. 28.3. Complete the sentences. Look at A, B, and C opposite to help you. 1. Distant spread of tumor cells is known as metastasis. 2. Many symptoms of cancer, such as difficulty swallowing, are due to malignancy. 3. The opposite of painful is painless. 4. A malignant neoplasm is called a cancer. 5. Tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. 8. A hepatic liver suggests metastasis. 2021. Pregnancy and childbirth. Exercise. 21.1. Complete the sentences. Look at A, B, and C opposite to help you. 1. A baby that is born a week before the EDD is premature. 2. A termination of pregnancy might be necessary for medical reasons. 3. The first 3 months of pregnancy are known as the first trimester. 4. Fetal distress in the first stage of delivery is an indication for cesarean section. 5. It was a brief presentation and delivery was by forceps. 6. A miscarriage is another term for a spontaneous abortion. 7. The umbilical cord was wound tightly around the baby's neck and it was unfortunately stillborn. 29.2. Complete the table with words from A opposite. Verb, abort, noun, abortion. Verb, deliver, noun, delivery. Verb, induct, noun, induction. Verb, miscarry, noun, miscarriage. Miscarriage. Verb, present, noun, presentation. Verb, terminate, noun, termination. 21.3. Dr. Bennett, an SHO, is presenting a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of verbs from 29.2 above. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was aborted, and another one a year later, which spontaneously miscarried. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section. Unit 30, the respiratory system. Exercise. 30.1. Make word combinations using a word from each box. Look at A and B opposite to help you. Bloodstain. Bloodstain. Red sounds. Plural rural. Productive cough. Vocal resonance. 30.2. Rewrite the question using words that are better known to patients. Look at A opposite to help you. 1. Is your cough productive? Are you coughing phlegm? 2. What color is the sputum? What is the color of your phlegm? 3. Is it ever putulent? It is ever yellow? 4. Have you ever had hemostasis? Have you ever coughed blood? 5. Do you suffer from dyspnea? Do you have trouble breathing? 30.3. 1. A patient who has a loose cough produces phlegm. True. 2. Flatus are heard when the airways are narrowed. False. Freckles suggest the presence of fluid in the lungs. 4. Wheezes are typical of pleurisy. False. Wheezes are typical of people with asthma. 5. A pleural roof is a sign of asthma. False. A sign of asthma is a wheeze. Unit 31. The skin. 1. Exercise. 31.1. Complete the description of herpes zoster shingles by replacing the medical words in brackets with ordinary English words. Herpes usually starts with pain and soreness, then red spots that develop into groups of small blisters over a particular area on one of the side of the body. In most patients, new rashes continue to appear for 3 to 5 days. The small blisters become filled with pus and then form scales. In severe cases, there might be scars afterwards. 31.3. Read the description of the rash of rubella and complete the notes. Look at the A and B opposite to help you. The spots are scattered pink macules, which appear first behind the ears and on the forehead. The rash spreads rapidly. First to the trunk and then to the limbs. Location and distribution: trunk, limbs, forehead, and behind the ears. Scattered. Type of lesion: macule. Color: pink. 31.3. Complete the notes for the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution: chest, localized, grouping, clusters. Type of lesion: papule. Color: pink. 31.4. Complete the notes for the lesion in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution: under the right eye, localizing. Grouping, scattered. Type of lesion: fleshy nevus. Color: brown. Unit 32, the skin flu. 32.1. Write the corresponding medical term for the ordinary English words and say what kind of force is involved. Look at A opposite to help you. Common word: bruise. Medical term: contusion. Type of force: blunt. Common word: cut. Medical term: incised wound. Type of force: sharp. Graze. Common word: graze. Medical term: abrasion. Type of force: blunt. Common word: scratch. Medical term: abrasion. Type of force: blunt. Common word: stab wound. Medical term: penetrating wound. Type of force: sharp. Tear. The medical term: laceration. Type of force: blunt. 32.2. Choose the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are scratches above the left eyebrow and on the left side of the neck, a laceration to the left side of the lower lip, and tears to the left cheek. 32.3. Write a description of the injuries shown in the illustration. Look at A and B opposite and at 32.2 above to help you. There is a laceration on the left shoulder and a cut approximately 6 centimeters in length above the left nipple. 32.4. Complete the sentences. Look at A, B, and C opposite to help you. Frequent changes of position are necessary in the immobile patient to prevent the development of a pressure sore. 2. He had several penetrating wounds in the abdomen from the knife. 3. He was knocked unconscious by a heavy blow to the head. 4. The wounds were only superficial and required no treatment. Unit 33, the urinary system, exercises. 33.1, look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms where possible. Complaining of frequency and nocturia, no dysuria or hematuria. Extreme, a little weaker. No incontinence apart from occasional dribbling. 33.2. Match the patient descriptions of their symptoms 1 to 7 with the medical terms A to G. Look at A opposite to help you. 1. I have to pee every half hour or so. Frequency, B. 2. I get a scalding pain when I pass water. Dysuria. 3. I have to get up several times to pass water at night. Nocturia. 4. I have to rush to go to the toilet. Urgency. 5. I have trouble getting started. D. Hesitancy. I can hold my water. Incontinence. 7. I passed some blood in my urine. Hematuria. 33.3. Write the doctor's question for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question for urgency. 1. Are you having any trouble with your waterworks? 2. How often is that? 3. What about at night? Do you have to get up at night? 4. Do you get an urgent need to go to the bathroom? 5. Do you have any trouble getting started? 6. Is the stream normal? 7. Do you ever lose control of your bladder? 8. Have you ever passed blood in the urine? 33.4. Describe the findings of the laboratory report in words. Look at B opposite to help you. There was a trace of blood, gross protein, and no cast. Unit 34, Basic Investigations. Exercises. 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the underlined expressions used 1 to 4 to expressions with similar meanings from A opposite. Right, Mr. Gold. Because you've been having these headaches, I'm going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you might find your vision a bit blurry. This will wear off after an hour. I need to get rid of as much external light as possible. This means closing the blinds. Now, I'd like you to look straight ahead at that clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me, look at the clock. A. The examination is done with dimmed lights. 2. B. A topical mydriatic solution. 1. C. To aid dilation. 3. D. Fixate on a target. 4. 34.2. Complete the instructions. Look at B opposite to help you. 1. Wrap the cuff around the patient's upper arm. 2. Place the stethoscope over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. 3. Close the bulb on the pump. 4. Pump up the pressure to at least 100 mmHg. Open the bulb a little and slowly deflate the cuff while listening and watching the pressure gauge. 5. The first sound you hear is the flow of blood through the brachial artery. The value on the gauge at that point is the systolic blood pressure. 6. Continue listening while you slowly remove the cuff. 7. The diastolic blood pressure is measured when the sound completely disappears. 34.3. Complete the test. Look at C opposite to help you. Phlebotomists are especially trained in taking blood. They are skilled at venipuncture, puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate a suitable vein, the patient might be asked to make a fist, or a tourniquet might be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to press gently. This helps to stop the bleeding and prevent swelling at the site. It is important that the specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigations will be carried out.